Hello everyone. Today we will be discussing one of the very important topic, kidney function test. Basically, kidney is the organ which filters your blood. The test which we used to go BUN and creatinine. But what happened is over the period of time, this creatinine turned out to be not a very good test to give us insight into functioning capability of your kidneys. These days we use another test we call EGFR, the calculation which is driven from your EGFR. And we got a lot of questions as a physician since the EGFR has been introduced. I have gotten more calls from patients asking for EGFR because when they suddenly see their record, they will say stage 2 kidney disease, stage 3 kidney disease. And I want to explain that in detail. As I said, if you see the creatinine is normal is 0.7 to 1.4. If it goes from 1.4 to 1.6, it doesn't look like much, but you might have lost 20 to 30% of the function. So we go with EGFR now. That means your kidney filters about 120 to 25 ml of blood per minute. As we go through circle of life, there is some functional decline in the function of the kidneys. So if your function is between 120 to 90, we call stage 1 kidney disease. From 90 to 60 is stage 2. From 60 to 30 is stage 3 disease. And that stage 3 is divided between A and B. But for this discussion, we will keep it between 60 to 30 is the stage 3. And that is where you will find most of the seniors will find stage 3A or stage 3B kidney disease. I want to make sure you understand that does not mean kidney failure. That means your kidney's ability to filter is going down. You should not put any over-the-counter medication because what we see is the most common is people have a habit of taking ibuprofen, naproxen, goody powders, and sometimes people use a lot of aspirin. Anything above 3, make sure you ask your physician, and also you should let your specialist and other physician know that you do have a stage 3 kidney disease. But that does not mean you have a kidney failure, because that is where I have seen a lot of emotional reaction happening to the patients. If they goes from 30 to 15 is stage 4, and then anything less than 15, you will end up on dialysis. These are the normal values which I have described you, sodium, potassium, chloride. Uric acid is one of the tests which we do it for gout, and that is also worth mentioning. We don't do these like uric acid all the time unless you have propensity to develop a gout. Further, there are other electrolytes, magnesium, selenium, zinc, those can be tested, but most of the time their function is very limited unless you are on certain medications for heart failure where we believe we must check it, but they are not part of your normal testing. They don't add any extra information unless you have a reason for those electrolytes to go down. Thank you very much.